All right, if everyone is ready, we can get started. Hi, everyone. Thank you for joining us. Today, our talk will be focused on shifting the narrative, placing trans and gender diverse healthcare needs first. This talk will be given by our group, in which we'll do introductions in a little bit. Today, we'd like to focus on the fact that our talk is based off of the Spark Reproductive Justice Now's policy report titled Shifting the Narrative, a Reproductive Justice Analysis of the Health Inequities Affecting Trans and Gender Diverse Folks in Georgia and the Policies Necessary for Progress. This policy report was originally started back in 2017 when I joined Spark for the summer as a former research and policy fellow, and was really able to focus on the healthcare barriers that exist for this population. And then with the group that I'm presenting with today, able to expand on the current policies at hand that continue to oppress this population and the policy recommendations that we are making here at Spark Reproductive Justice Now in order to enable this population's access to healthcare. If you could go to the next slide, Sabrina. Thank you. Today, our agenda will start with introductions of the group. We will then do an overview in which we will discuss the discrimination in healthcare facing this population, which will then be followed up with a breakout discussion. Second, we will then talk about the policies at hand currently affecting this population, followed by a breakout discussion. And lastly, a policy recommendation talk followed up with breakout discussions. And then we'll end on a final discussion. Next slide. And so everyone can hop in and we can give a brief description of who we are. My name is Habran Kalecha. My pronouns are she, her, and hers, and I am currently a fourth-year medical student at the University of Kansas School of Medicine, and I was a fellow intern at Spark Reproductive Justice Now.
Hey everyone, my name is Jen Mahan. My pronouns are she, her, hers, and I was Spark Reproductive Justice Now's first If, When, How Law and Policy Fellow, and I had the privilege of being a co-author on the report.
Hi everyone, I'm Alex Moody. I am the current fellow at Spark Reproductive Justice Now. Nice to see everyone.
Hey, good morning, everyone. Thaisa Marmoto, I, she, and they pronouns. I'm a senior policy counsel at the National LGBTQ Task Force.
Hey everyone, I'm Sabrina Rewald. I am Secretary of the Board for Spark Reproductive Justice Now, a co-author of this report, and I'm also an international lawyer currently working towards an LLM in international human rights law from the Netherlands.
Hi everyone, my name is Cortez Wright. My pronouns are they, them, theirs. And currently I'm the Development and Marketing Manager at the Southern Center for Human Rights.
Thank you, everyone. So we are going to start with our first talk of the three sections that we'll discuss today. And the first is the discrimination in healthcare facing trans and gender diverse folks in Georgia. And so starting off as background, approximately 1.4 million or 0.6% of the US population identify as trans or gender diverse as of 2016. A recent study suggests that young people who identify as trans or gender diverse may actually be closer to 2.7% of the US population. And Georgia is among the 5 states with the largest adult trans and gender diverse population and community. Although today our talk is going to focus on the healthcare discrimination, it's really important to address that this population faces discrimination, harassment, and violence due to other systems, which are including but not limited to education, housing, law enforcement, and especially the legal system. I want to start my talk by saying that trans and gender diverse folks require the same type of healthcare as cisgender people. Trans and gender diverse folks may additionally require gender affirming medical and surgical care, and they may have unique gynecologic and urological needs, But for many, accessing healthcare system is filled with a lot of barriers. Some of these barriers include finding a healthcare provider who is gender affirming. Healthcare providers and staff can often be lacking the cultural humility and knowledge about gender affirming language and care to provide to these populations. Discrimination that trans and gender diverse folks face in acquiring work, which is directly linked to their ability to access insurance and therefore access healthcare. Lack of insurance and coverage for gender affirming care. And in addition, healthcare providers and systems at points can sometimes refuse to provide care to this population. And lastly, when trans and gender diverse folks do not feel like they're heard, they have reported at times that they are less likely to give accurate information and actually withhold information, as well as postpone care, leading to poor outcomes for this population. I will next talk about the intersectionality of health and the social determinants of health. So the founders of reproductive justice movement adopted this idea of intersectionality, and we use it in order to strengthen our understanding of the complex ways in which disparities in society continue to be upheld. Intersectionality acknowledges the existing power differentials that are at play in a person's life. These are based on their experiences, but also the social constructs, and these include but are not limited to racism, transphobia, xenophobia, classism, and ableism. While the social determinants of health are the conditions in which an individual is born, an individual works, plays, and ages, these often include factors such as economic stability, environment, educational attainment, access to healthcare systems, that all of the aspects that ultimately impact a person's health and wellness. But furthermore, they also include the social determinants of health that consider the cultural and societal constructs. These include, like I've said prior, classism, sexism, homophobia, and in an end, they all impact a person's overall health and well-being. These and other constructs actually work together to produce disparities in illness, poor health, and the person's ability to live a life in which they thrive. This also increases the mortality among individuals who are marginalized by society. For example, in 2015, the transgender study concluded that transgender people of color actually experience deeper and broader patterns of discrimination, and especially compared to those faced by their white transgender counterparts and the general US population. This includes disparities in employment status, access to housing, and economic status. In regards to my general point that I made prior, economic instability can have significant impact on access to healthcare for trans and gender diverse folks. For example, an analysis of the 2019 Black census found that 50% of Black transgender diverse folks reported putting off seeing a doctor for financial reasons, compared to only 35% of their cisgender counterparts. These issues are further compounded when trans and gender diverse folks face additional barriers such as documentation status, leading to an increase in housing instability and violence at higher rates. So overall, the data supports that trans and gender diverse folks not only face significant barriers, but these barriers have devastating impacts as they fare worse in their overall health outcomes compared to cisgender people. A study at the Emory University School of Public Health reported that compared to cisgender participants in the study, trans and gender diverse populations were more likely to have higher rates of nearly all mental health conditions, including depression. While another study looked at the prevalence of disabilities, mental health, and chronic conditions in this population over a 2-year period of 2014 to 2016, and concluded that this population experiences higher burdens of disabilities, poor mental health, and multiple chronic conditions compared to non-transgender diverse populations. Lastly, I'll talk about the role of reproductive justice in healthcare. It's really important to acknowledge that trans and gender diverse communities cannot be expected to eliminate or mitigate the experiences of discrimination and inequity on their own. Experiences with violence, harassment often result in barriers, delays, or actually delivery of inappropriate healthcare, which can exacerbate poor health outcomes. The lack of accountability and responsiveness from society to address this injustice for this population is no longer something we can continue to accept. And reproductive justice is a framework rooted in the belief that individuals and communities should have the resources and the power to make these sustainable decisions about their bodies, their genders, their sexualities, and their lives. Reproductive justice applies intersectional analysis to these social issues, meaning it demands recognition of the person as a whole. Reproductive justice also believes that disparities in access to healthcare depends on the following factors. It first starts with a person's and their community's ability to recognize the healthcare needs, their ability to seek these healthcare services, to reach or obtain healthcare services, to actually be able to utilize these services, and finally, to engage the health system in a manner that results in them being offered the healthcare that they deserve and that their community deserves. So at this point, we will move to our first breakout room in which we'll discuss the 3 questions based off of this talk. And the 3 questions that we'll have are, if we could go to the next slide, we will be discussing where you see opportunities to address systemic discrimination against trans and gender diverse populations in healthcare settings, what changes you'd like to see happen in healthcare education, training, and facilities to address this discrimination. And there's a lot of talk about what approaches we can take to addressing these healthcare disparities. So I'd love to hear more about what stakeholders you'd like to see involved. And last, what more could reproductive justice organizations be doing to support trans and gender diverse populations as they navigate healthcare? And at this point, we should be maneuvering to breaking.
I need to be put back into my group. Hi, this is Israel. I think I might need to be put back in my group.
Okay, working on that. Let me see.
Also, I would talk about the safety system. Safety systems are really important with their
Aglo, are we in a group now?
Yeah, I don't know why it didn't put you in your room.
I see there's also Jesse Rosales, who's also still here.
That's weird. I mean, okay, let me see if I can troubleshoot.
Sure, no worries.
Sabrina, I have no idea why it's not putting you in your room.
I can wait.
Yeah, sorry
mean,
about that. I don't know why it's not.
That's okay.
working.
It's not the end of the world if I'm not entered into a room.
Yeah, and the room I put you in, Hebron, is there, so there's a
Oh, she is?
facilitator. Yeah,
Okay, perfect. How many rooms are there?
4.
Okay, that's totally fine.
Oh, wait, maybe you need to stop sharing your screen. Maybe that's what's happening.
And we're back. Okay, let me share my screen again and we'll get back on track.
I hope you all had wonderful discussions in your breakout rooms. I know that we had some in ours. And if you felt like it was too short and you want to continue the conversation, please feel free to do so via chat. I'll go ahead and get started as Sabrina pulls up the slides. Oh, here we go. Sabrina and I are going to be talking about the policies affecting the health and well-being of trans and gender diverse folks in Georgia. And I just wanted to start by highlighting a lot of what Habram was talking about, that the impacts on queer and TGD folks' mental and physical well-being are exacerbated when there aren't any non-discrimination protections in place. It undermines human rights, access to services for health and wellness, and economic stability. And studies show that queer and TGD folks, especially those who experience marginalization on multiple levels, based on disability, age, race, etc., are more likely to experience poverty than non-queer and TGD folks as a result of that persistent and systemic barriers that they face. And research also shows that experiences of being discriminated against increase a person's likelihood of suffering emotional distress, anxiety, depression, and self-harm. And so one foundational protection that queer and TGD folks could benefit from is nationwide federal non-discrimination protections. And this summer, the Supreme Court ruled that in employment settings, the prohibition on discrimination based on sex in the Civil Rights Act extends to discrimination based on gender identity and sexual orientation. While this landmark win has many potential impacts in housing, healthcare, employment, and other fields, it still relies on courts to affirm and apply the Supreme Court's interpretations to other agencies and laws. I think someone's unmuted. You just mute to, thank you. Moreover, the current administration continues to push for rules and regulations that run counter to the ruling, including removing protections for queer and TGD folks who need access to housing services and shelters. So to make these protections stronger, many advocates are pushing for the Equality Act, which would explicitly prohibit discrimination on the basis of sexual orientation and gender identity. And it would expand these protections in public accommodations and federally funded services. The Equality Act passed in the House last year, but it hasn't been passed in the Senate. Because the Equality Act may not be realized with our current Senate makeup, advocates often turn to state and local laws to add protections for queer and TGD folks, which my colleague Sabrina will talk more about.
Thanks, Thaisa. So until we achieve comprehensive federal protections, and even once we do, state and local protections are another really important route to not only to prohibit discrimination, but also to improve total wellness for trans and gender diverse folks. The obvious limitation on these is the fact that once a person leaves a specified jurisdiction, then that protection ceases. But nevertheless, state and local initiatives can be really critical to shifting cultural and societal norms and preventing avenues for really strong at-home civic engagement. So right now in the US, there are a smattering of cities and counties that have non-discrimination ordinances in place that are related to gender identity. These are really critical, but it's really important to understand that many of them don't offer like wholly comprehensive protection. They may offer it for a specific arena like housing or like public accommodations, but exclude the other. So in Georgia, we currently have 11 cities that have achieved comprehensive non-discrimination protections. And so when I say comprehensive, I mean essentially that they include employment, housing, as well as public accommodations. And so 11 cities have instated non-discrimination protections for those three, and the Macon-Bibb County Commission just voted on Tuesday to include a comprehensive ordinance making it the only county, I believe, in Georgia to do so. So these ordinances, even despite those achievements, they only cover 10% of the population in Georgia. And there are local ordinances in other states that have been successful. In Florida, my understanding is there's coverage for 60% of the population due to local ordinance protections. And Georgians are also fighting for this to be the case across the state with state legislation. And that's because Georgia remains one of the 30 states that has yet to pass a statewide non-discrimination law on the basis of gender identity. And but in fact, the state legislature has actually made a lot of attempts in the opposite direction to either prohibit local ordinances from existing, which is currently the situation in North Carolina, in Tennessee, and Arkansas, or to impose religious exemption laws, which would essentially be a way to sanction discrimination. It's also important to consider that even if we were to achieve a federal protective legislation like the Equality Act or statewide protections in Georgia, it would be a massive achievement, but it's not an entirely magical fix. There's other statewide laws and policies that currently do and would continue to disproportionately affect trans and gender diverse folks. So things like HIV criminalization laws, limitations on abortion access, and inadequate access to healthcare for low-income folks that can be exacerbated by Medicaid waivers or refusals to expand Medicaid. So that's why when we were drafting this report, when we looked at the state of healthcare in Georgia, we were also looking at these types of not so clearly healthcare oriented policies. And there were also some proactive policies, including the creation in Georgia of a PrEP pilot program. PrEP is pre-exposure prophylaxis, preventative medication to prevent HIV. Incredibly effective and important. And so that's a measure to kind of ensure that there's greater access to PrEP across the state. And then there was also Georgia's decriminalization of needle exchanges, also an immensely important initiative for trans and gender diverse folks, particularly those who might use street hormones due to a perceived or real expectation of discrimination from healthcare spaces. And so in the report, we took an intersectional approach per Kimberly Crenshaw's coining and clarification of the term. We took into account that it's not just about identifying identities and experiences, but identifying how the structures that societies put in place actually turn identities into conduits for vulnerability. There's no one person who is inherently vulnerable. They're made vulnerable by the policies and environment that's surrounding them, which is an idea that I actually read in a tweet this morning, and I can't cite to the owner, but it's not my original concept, but it really, really stuck with me. And all of this to say that there's really a variety of ways that structures and institutions that folks pass through and interact with every day can have a harmful effect. And in just as many ways, there are ways that folks can get involved to ameliorate and improve access to healthcare and overall wellness for trans and gender diverse folks in their communities. And Thaisa has a really great story about her own personal experience with running a campaign.
Yeah, thanks for that, Sabrina. Though not a policy, the task force had the opportunity to work alongside several organizations in Florida, including Equality Florida, Let My People Vote, and FRRC, to help pass Amendment 4 in 2018, which is a state constitutional amendment that would restore the right to vote to more than 1.4 million Floridians. And during that time, I worked in policy alongside my organizing colleagues. We shared resources, crafted messages, to ensure Amendment 4 would meet the 60% threshold it needed to pass. So we canvassed, we told stories, and we changed hearts and minds to pass this monumental amendment that would change the landscape of elections. And it was Desmond Meade that led this effort that began more than a decade ago. And the task force and other organizations supported that effort however we could. The need for change came from, and the movement was led by people who were directly affected by these barriers. The folks directly impacted, the folks who had their votes taken away from them because of a Civil War era constitutional provision intended to uphold white supremacy, launched this movement because they saw a need and worked to achieve to change it. Many movements begin this way, and many policy changes are a result of direct efforts from those who are most impacted. And we've seen so many successful partnerships with the same model. where those who don't experience the same barriers and organization resources can support these movements led by those directly impacted and those from impacted communities by listening, offering support, funding, resources, and amplifying these efforts. It was through grassroots efforts that Georgia passed the pilot prep program and needle exchange program that Sabrina mentioned earlier. We often say we can't achieve liberation if we can't imagine what it looks like. And so we wanted to invite you to think of the policy changes you wish you could see in your communities. If you could go to the slide with the questions. Thank you. So we want you to take some time to discuss what policy you'd want to see implemented in your communities, what the ideal or necessary scenario or political climate you would need to see that happen, what the barriers are to achieving this policy, and what it would mean for your communities if this policy was realized. So I just shared the questions in the chat, and hopefully we can go into breakout rooms and discuss that.
Hey, Israel, do you remember what room you were in? Hey, Israel, do you remember what room you were in?
Hi, lots of technical difficulties. I think I was in 2.
Okay, I'll put you in there.
Thanks.
Hi, folks. Welcome back.
Thanks for sharing your screen, Sabrina. Okay, great. The policy recommendation section. So Alex and I had the opportunity to work on this portion of the workshop. And so we're going to be reviewing what policy recommendations Spark has as a response to the research that was conducted for the previous two sections that we just reviewed. And so the policy section recommendations of the report calls for real change to take place throughout the structures and institutions that we all inevitably pass through, specifically the structures and institution systems that TGD folks will have to engage with at some point. And so the report includes 4 overarching goals, as well as individual recommendations for healthcare providers and government agencies. And so the first goal that's outlined in the report is the enactment of non-discrimination protections. And so you heard Sabrina give an overview of how these protections in the current state are really patchwork in terms of how they're enacted and how they're not really comprehensive at this point in time. And so those non-discrimination protections, meaning protections for gender identity that are comprehensive both in terms of substance and also reach. And so that really means that these protections, as Sabrina was saying, need to be reinforced through federal, state, and local law. And so the report focuses primarily on protections that aim to ensure access to accommodations, and that includes housing and employment. And the second overarching goal for the policy recommendation section is the reduction of barriers generally. And that sounds really vague without context. And so a barrier that immediately comes to mind is the process that TGD folks have to navigate when it comes to gender identity and documentation. So thinking of birth certificates, licenses. And so it's that process is really dependent upon where an individual lives. And so for instance, in the state of Georgia, if someone wants to have their gender marker changed on their identification documents, they are required to go through unnecessary medical interventions. They must produce a letter from a physician to a court. Whereas in other states, it really looks like more of an administrative process in which someone might just have to fill out a form and then pay a fee. And so Spark is actually in the process of launching a program that would work to amend what that process looks like in the state of Georgia. And so that's just one example of what we mean when we say reducing barriers. And then the third overarching goal of the report, it's to recognize holistic health and wellness and to consider root causes. And quite often, there's a tendency to shame or blame folks for negative health outcomes in particular, without actually considering the impact of discrimination, systemic oppressions, and racism. And then the fourth goal is to amplify the voices and experiences of TGD folks in the policymaking process. And there really needs to be an emphasis on visibility and participation throughout the entire process. Too often we find that this is an afterthought. And, folks that are directly impacted really need to be part of the process in terms of creating not only what the solution should be, but also how they are enacted. And doing that in a way, you know, that's really not transactional or tokenized. And so the specific recommendations within the report for healthcare providers, there are 3 recommendations. The first is cultural competence, humility, and intelligence training. And while that, you know, really is an important step, there's often a temptation for healthcare providers who want to be inclusive, but unfortunately are unwilling to look at and make structural changes to how they conduct their business. And so you see that there's sort of limited training, and then that's really where the intervention stops. And there needs to be recognition that the system of access itself is structured to perpetuate the oppression and exclusion of TGD folks. And so providers really need to be willing to address the structural root of the problem in addition to training not only themselves, but also their staff, because there are so many different, you know, folks within a healthcare setting that an individual will have to interact with. The second is the use of TGD inclusive language. And that's not just in terms of inquiring about an individual's pronouns and then respecting them and using them correctly. It also includes the changing of necessary policies, paperwork, signage throughout, for instance, computer systems, and all of these different things that may be overlooked that are not trans-affirming. And then the third recommendation for healthcare providers is tracking experiences of discrimination and taking steps to remediate. And it's really important to note that experiences of discrimination are diverse. They don't always show up as obvious or blatant transphobic bigotry or harassment. And for that reason, more subtle effects of discrimination must be taken into account. And those could include lack of insurance coverage for gender affirming care, or, you know, TGD folks really having to educate their providers. And we know that that shouldn't be the case, because that's really one of the reasons why we're seeing a lack of care when it comes to TGD folks accessing services. And then also hearing directly from the folks, you know, who are experiencing discrimination, believing them, and then taking the steps to address the problem is also extremely critical. And so now I will turn it over to Alex to discuss the recommendations for government agencies, and they will lead us into the discussion section.
Great, thank you so much, Jen. All right, so we're highlighting 4 different policy changes or recommendations for governmental agencies, but this is absolutely not an exhaustive list. There are a lot of changes that can and should be made. So our first one is that these agencies regularly seek input from LGBTQ organizations and communities, and then of course that they take this input into consideration when they're making decisions. And ideally this means that policymakers are creating relationships with both like the bigger, more resourced, tend to be national organizations, as well as smaller grassroots ones that may have a more direct connection with people on the ground. Because these smaller grassroots organizations tend to have a better idea of what the actual needs of the community are. An easy way for agencies to do this is to engage meaningfully with notice and comment rulemaking. So lots of LGBTQ organizations that work with TGD folks are putting thoughtful comments together and submitting them to agencies. So reading and taking into consideration those recommendations is an easy way to implement this change. Our second recommendation is more specific. We recommend that the Department of Health and Human Services rescind the rules and guidance that exclude gender identity and sexual orientation from the definition of sex discrimination. So specifically, this has to do with Section 1557 of the Affordable Care Act, because the Trump administration, Department of Health and Human Services, promulgated a rule that intentionally excludes discrimination on the basis of gender identity and sexual orientation from federal anti-discrimination provisions in healthcare. Luckily, one day before the rule took effect, it was blocked by a federal court. So at the moment, the rule exists in its finalized form, but it isn't operative. With the incoming Biden administration, it's likely that whoever gets appointed to work at the Department of Health and Human Services will take some steps to rescind this rule and the guidance, but it's important that we keep pressure on them to do so quickly and effectively. All right, so our third recommendation is that policymakers take the steps to end the transgender military ban. And this could be done unilaterally by the Biden administration, but there's also several pieces of federal legislation that have been introduced to reject the existing ban and to codify non-discrimination protections. So we recommend pursuing the legislative route as well, because that's kind of a more robust protection for TGD folks, as opposed to something that's vulnerable to change based on the administration. All right, and finally, we recommend that all relevant agencies take proactive steps to end the imprisonment of, attacks on, and indifference to Black and Brown refugees, many of whom are facing persecution based on their identities, or their LGBTQ identities specifically. And so it's important to note that the immigration policy in the US is very complex, and the structure of it crosses a bunch of different agencies in the state and federal government level. So this is really frustrating, but it also creates a lot of different points of access to put pressure on decision makers to take the steps they need to do to make our country even a little bit hospitable to refugees who are facing persecution based on LGBTQ identity. All right, if I could have the next slide, please. All right, so these are our three breakout session questions. We understand they're multi-part and very complicated, so please feel free to jump around and talk about whatever speaks to you within the questions. I can also copy and paste it in the chat.
Hey, Agbo, thank you so much for your help.
No problem. I hope everything is going smoothly.
It is. I decided to just stay in here so then I can help navigate to the next finale.
Okay, no problem. Yeah, I just set it for 5 minutes. So once that ends, everyone will be pulled back in.
Wonderful. And I don't know exactly what happened, but it's on my end. When I'm in the chat, it says co-host, but I don't have co-host capacities.
I don't know why that's a thing.
It's worked out fine, but just, yeah. I don't know if there's more sessions or anything, but Zoom always does something different.
Yeah, like this whole conference, Zoom has just had a mind of its own. So we've had to adjust.
I feel like every time I log on and I go through the steps of what I'm supposed to do, there's always one or two people who just cannot do what you think they should be able to do.
Exactly. But we make it work.
We make it work, and it works out that we had so many presenters so that someone out there that was a co-host could share the screen and You've been really helpful in creating the breakout rooms and everything. I don't know if we would have been able to do that on our own.
Awesome, great, thank you.
I'm sorry, I ended our breakout room early, I think. We had 25 seconds left.
It's okay.
I clicked the button. I'm sorry.
That was the fastest breakout.
And I
Every-
the longest questions too.
Every breakout, I get zoomed out like mid word or mid someone else.
Yeah. Well, it's been such a pleasure to talk with all of y'all. And what we should do just quickly now is, yep, we're going to put our emails into the chat because we recognize that there were a lot of questions asked today and not a lot of time to answer or discuss. And I just want to also say thank you to everyone who is presenting today, who has been involved in this report, really putting in time and effort. And it's just been a pleasure to be working with you all. So I really appreciate every single one of you and everything you've contributed and this community we've been able to cultivate.
Thank you all so much.
Yeah, thank you all. And thank you all for powering through with us this morning. I know 11 a.m. on a Sunday is a rough time for any kind of conference, let alone a virtual conference.
Thank you.
Yeah, thank you all. I love the breakout rooms. Thank you.
Hey team.